Welcome, everyone. I can see people coming into the room. Into the Zoom room. We are so thrilled to have you joining us for the launch of the Connecting Climate Minds Global Research and Action Agenda for Climate Change and Mental Health. This has been a moment almost 2 years in the making now at this point, from when Wellcome was envisaging having this global agenda to foster research and action in the climate change and mental health field. So yeah, it's such a privilege to have many people. We can see over 100 now joining, and I'm sure you're coming from various parts of the world, potentially early in your morning, late in your evening. So if you would like to share, if you just make sure you share with everyone in the chat, if you want to share where you're coming from today, that could be where you're sitting in the world or what perspective you're bringing into this space. We'd love to hear from you. So please share your name and where you're from, or the perspective you're bringing to climate and mental health today. Thanks. I can see people coming in. And while you're doing that, I can introduce myself. So I'm Dr. Emma Lawrance, and I lead the Climate Care Centre at Imperial College London. And it's been my great privilege to work over the last 18 months with a truly global, very diverse team, including the Red Cross, Red Crescent Climate Centre, regional community conveners from organizations around the world, a lived experience working group, an amazing advisory board, and many, many different experts and perspectives coming in, some of whom you'll get to meet on this call today. So we'll just give everyone one more minute to come in. I can see people coming from Haiti, from India, from the UAE, from Toronto, or Toronto, as you're probably supposed to say it, Tunisia, Brazil, Nigeria, so yeah, Taiwan. So thank you so much, everyone, continuing to share in the chat, and people coming from many different disciplines as well: education, public health, climate crisis, health inequities, urban health. So yeah, we can see this group coming into the call really reflecting a lot of the diversity we've heard contributing to this agenda. So thank you all so much for joining. We'll just give one more minute for people to come in. But maybe if we can go to the next slide and I can explain what we'll hear in the next hour. So it'll be my great pleasure in a moment to pass over to Dr. Marina Romanello, who's going to give the opening remarks to this session. She's the director of the Lancet Countdown for Climate and Health based at UCL. And that's also a Wellcome funded project, and it'll be very exciting to hear her perspectives on the agenda. Myself and my wonderful colleague from the Climate Care Centre, Jessica Newberry, will then give you a very high-level overview of what this agenda is all about and how it came to be. And then we'll pass over to what I'm sure will be a very engaging panel discussion and Q&A with you as the audience, which will be moderated by my Climate Care Centre colleague, Dr. Omneya Elamrani, with Dr. Sandeep Maharaj from the University of the West Indies, Olude from SustyVibes in Nigeria, Dr. Alan Dangor from Wellcome Climate and Health, and Professor Pamela Collins, who's now based at Johns Hopkins. And importantly, is also Professor Collins is also the mental health lead of the Connecting Climate Minds Advisory Board. So I will now pass over. I think people are still piling in, but I will pass over to Dr. Romanello, and she can kick us off. And please keep sharing in the chat. Thanks, everyone, for sharing where you're from.
Hi, everyone. Thank you so much, Emma. Thank you, everyone, for joining. I'm so delighted to be here at the launch of this very important piece that will be, I hope, transformational to how we address climate change and mental health. I have been part of the board of the Connected Climate Minds project, and I have been working with Emma, with Omnia, and with many others in the group, and so how hard they worked to put this agenda together. So I'm really delighted to be here with you. As Emma just said, I'm the executive director of a Wellcome Trust-funded project called the Lancet Countdown. The Lancet Countdown produces indicators that monitor the evolving health impacts of climate change, as well as the health opportunities, the health benefits, and the health co-benefits that come with our climate actions. Our indicators year on year show really clearly how the health impacts of climate change are rapidly worsening across all of the dimensions that we monitor. We're seeing that the risks that climate change poses on health are growing really rapidly. We monitor the impacts of extreme heat exposure, of extreme weather events. We monitor indirect impacts through the increased suitability to the transmission of infectious diseases, risk to our water, food security, risk to our social infrastructure and to the economies on which our health and well-being often depends. And we monitor these indicators comprehensively. But every year we get one same question. That is, why are you not monitoring mental health? And that is a big glaring gap that we still have in our monitoring process. We monitor the impacts on sentiment of extreme weather. We address the impacts and the implications of the changing climate on mental health. We know there's evidence that tells us how much this impacts on our physical health, on our socioeconomic conditions, is affecting our mental health. But we still have enormous gaps in being able to adequately monitor that. There's big gaps in our understanding of the full implications and the full dimension of the impacts of climate change on our mental health, which can be as, if not more important oftentimes than our physical health impacts. And when we get asked this question, the answer is, we don't have the data. We don't have the models. There's still a huge scarcity in the understanding. There's still a huge scarcity, often in the acknowledgement of mental health as a fundamental component of health. So when I saw that this project was coming together, when I was invited to be part of it, I was delighted because this is exactly what we need. We need to have a comprehensive, holistic and inclusive agenda that helps us build some of this knowledge base to help us bridge this gap. And not only to generate the knowledge, but importantly, to be able to inform the actions that are necessary to address mental health in the context of a changing climate, to protect people's mental health as the threats of climate change rise. As I said, I've been working closely with the team and I've seen the enormous amount of work that has gone in, and I'm sure that you're going to hear a lot about that today. But one thing that I wanted to highlight is how great it is to see that they've not only put together a research agenda, but they've partnered that with an action agenda. We don't have time to waste. We don't have time to wait before we take action, and we have enough evidence to do that. But we have to ensure that the evidence that we generate is tailored towards informing those actions that are needed to protect people's physical and mental health. And I was also very glad to see the transdisciplinary approach that was taken by the Connecting Climate Minds project, an approach that was very inclusive, that took different sources of knowledge, including the knowledge of those with lived experience, which oftentimes is where the knowledge that we need to hear from lies, and making the research community the vectors of that knowledge to ensure that their voices are heard and that they're addressed as we protect health through evidence-informed actions. So I commend everyone that has worked on this project. We from the Lancet Countdown are really looking forward, and we're really looking forward to seeing this research agenda coming out. And we're hoping that in the future we can work together a lot more closely to be able to bridge those gaps and to now, yes, truly encompass the full dimensions of health as we monitor progress to health and climate change within the Lancet Countdown's approach. So thank you very much, everyone. I hand back over to Emma, and I look forward to the discussion.
Thank you so much, Dr. Romanello. And as well as being the director of the Lancet Countdown, an equally important role from our perspective is that Marina was on the advisory board for Connecting Climate Minds. And as she said, fed in wonderfully to the work that we did over the last 18 months and to this agenda. So a huge thanks for that, and also for the incredible work you and your team do to make sure that everyone truly understands how deep the interconnections are between climate and health, and how much climate change is a massive health risk, but also climate action can be a massive health opportunity. And so that is the spirit of which we hope to bring mental health into that climate and health discussion, making sure that we're creating the right evidence, as you said, to move the dial in action, but already acting on the evidence we have. So thank you so much, Marina. I'm going to pass to my wonderful colleague, Jess, now, so we can give you a bit of a taster of this agenda we keep talking about.
Thank you so much, Emma. Hi, everyone. Emma and I are going to give a brief overview of the global agenda purpose, the process that was used to develop it, and some of the key insights and messages that have come from it. But to start off with, we wanted to share a short video. If we're able to share screen.
And mental health presents clear priorities. Connecting Climate Minds has assembled 900 people across 90 countries to develop an aligned vision for climate change and mental health research and action, with lived experience at its core. The Global Research and Action Agenda for Climate Change and Mental Health presents clear priorities to assist researchers, research funders, and decision makers in protecting mental health in a changing climate. The agenda contains 53 research priorities created through 21 dialogues. These cover priority evidence gaps across mental health impacts, risks and vulnerable groups, the pathways and mechanisms through which climate change affects mental health benefits of climate action, and mental health interventions in a changing climate. The agenda also sets out a vision for how to implement this research and translate evidence into action in policy and practice. Visit the Connecting Climate Minds Global Hub and discover how together we can create a safer climate for our minds.
Thank you so much, Ninka.
Connecting Climate Minds has assembled 900.
The Global Agenda, which has been developed through this Wellcome-funded Connecting Climate Minds project, has sought to set out a clear, inclusive and aligned vision for climate and mental health research. This is aimed to be a vision that can target research to where it can best help decision makers respond to the needs of lived experience of people who are living with the mental health impacts of climate change. A vision that can connect what we know with what can be done by providing a strategy for implementing and translating research into action. And we've aimed to bring together diverse expertise to both inform this agenda, but also to help foster a transdisciplinary field and a collective understanding and response to the deeply interconnected challenges of climate change and mental health in ways that can promote the thriving of all people. Connecting Climate Minds has been a truly global project, and it has been a privilege to work with the Red Cross Red Crescent Climate Centre, 7 regional coordinators leading work in all 7 Sustainable Development Goal regions, and a lived experience working group leading global work with young people, Indigenous communities and small farmers and fisher peoples, plus many co-conveners, advisors and contributors. And this global team brought together experts across disciplines and sectors into 21 dialogues throughout 2023. And these informed a series of research and action agendas, which are all available on our global online hub, and we encourage you to read them. The global agenda was developed by synthesizing these 10 agendas to identify globally relevant priorities for research and for action. And this was done in consultation and various rounds of feedback with an expert working group, through our global event that we held back in March, and an online survey, which was also used to identify top priority research questions out of a total 53. The global agenda is structured into a research agenda, which sets out priority areas for research, ranging from big picture categories down to really specific research questions. And it also contains an action agenda that aims to set out a vision for how we can better implement and translate research. And something we heard really resounding through this work is that research and action are deeply interconnected, and how research is done is just as important as what research is done. And this research must involve and benefit affected communities whose expertise we really sought to put at the centre of this work. Over to Emma.
Thanks so much, Jess. So we hope you'll all go and read the global agenda right after this, and of course take it up and use it. But just to give you a little taster, so we were so privileged, and to be honest, I was very humbled to hear from nearly 1,000 contributors across over 90 countries, bringing their different perspectives, their challenges and solutions from different disciplines, different sectors, different cultures, and different lived experiences. And so, of course, there was huge diversity in what we heard, but there was also some really strongly resonant themes. And as a taster of that, we heard about these compounding mental health risks where the climate crisis is amplifying existing risks to mental health, but also increasing the frequency of experienced traumas and challenges such that people can no longer recover from one potential climate-related disaster or stressor before another one hits. And so their mental health is being affected ultimately through multiple interacting and often compounding pathways and mechanisms. We also heard, though, of many relevant solutions and existing knowledge that comes from different disciplines and, again, different cultures and communities already adapting to or already with a lot of understanding about the links between climate change and mental health. And so we sought to bring these together and surface them in this agenda, but also in the case studies and lived experience videos and toolkits and other agendas available on the Global Online Hub. But in this diversity, there was a lot of different expressions and understandings of mental health and of climate change. And so it's really important as a climate and mental health field that we seek to acknowledge and understand these different perspectives, make sure that we're doing foundational field building to conceptualize what we mean by climate and mental health, and also how we measure these impacts of climate change on mental health and the benefits of climate action for mental health around the world. So we did a survey with over 70 experts to pick their top priorities out of the 53 research questions you'll find in the agenda, which are categorized into 4 different categories you see on the screen. And just to give you a taster of one of these questions out of the 53, the top one that came out in the impacts, risks, and protective factors was: what factors increase or reduce the risk of climate change-related impacts on mental health? Things like gender, livelihoods, or early interventions. Which of these factors are unique to the context of climate change, and/or what known risk and protective factors for mental health challenges are being compounded by climate change? This agenda will only make a difference if people take it up and use it and invest in it. And as Jess said, we heard that how that implementation is done is as important as what it contains. It must draw on the strengths of diverse disciplines and knowledge systems. And so I'm incredibly excited to see everyone coming from different perspectives in the chat and making sure that we center lived experiences to work with and ultimately benefit communities already living with mental health challenges compounded by the climate crisis. In the words of just one of the 960 plus contributors, our wonderful Hope Lekwa from SustyVibes in Nigeria and a lived experience working group member, he said, "It's my desire that this work inspires meaningful, lasting change that honors the courage and meets the needs of vulnerable people." So over to all of you to make this a reality. And it's my great pleasure now to get to hear from some of the other voices that contributed to this agenda. So I'm going to pass to Dr. Omneya El-Omrani, who's a policy fellow in climate and health at the Climate Care Center. It's also the health envoy at last year's COP28 and the youth envoy at COP27. She's a medical doctor from Egypt, and she's going to lead us in a panel discussion with some of the wonderful contributors to the agenda. So over to you, Omneya.
Yes, thank you so much, Emma and Jess, for this amazing presentation. We have now heard from Emma, Jess, as well as Marina, the key priorities within the global agenda, its purpose, its value, but also, as Emma said, how climate change and mental health research is done and what research is and needs to be done to address the key current gaps we are seeing in the evidence base and the evidence we need to inform action on the nexus between climate and mental health. And it is my absolute honor to now present our distinguished panel of our Connecting Climate Minds leaders, partners, experts, and together we will explore how the agenda has been developed, how relevant the agenda is to their work across all disciplines, and more importantly, how do we intend for this agenda to be translated into policy and action. And we also want to hear from all of you. So please keep your comments and questions coming through the chat. We are going to have a Q&A session right after our panel discussion, and we want to answer all your questions. So allow me now to introduce our panelists, who we had the incredible privilege to work throughout the past year. We have Dr. Sandeep Maharaj. He's the director of the School of Pharmacy at the University of West Indies. He's also the Senior Global Outreach Fellow at the Planetary Health Alliance, and importantly, a member and a leader of the Connecting Climate Minds Latin America and the Caribbean Regional Community team. We also have with us Ayomide Olude, who's the project manager at the Eco Anxiety Africa project at SustyVibes, one of our leading youth organizations of the Connecting Climate Minds Lived Experience Working Group. We also have Dr. Alan Dangur, the director of the Climate and Health at Welcome, our Connecting Climate Minds funder. And lastly, but not least, we have Professor Pamela Collins, who is the chair and professor of the Department of Mental Health at the Johns Hopkins Bloomberg School of Public Health and the co-chair of the Connecting Climate Minds Global Advisory Board. So let me start with Sandeep. And my question to you is, what stood out to you most in the Latin American and the Caribbean dialogues, as well as the regional agenda that you were leading? And how do you see your region represented in the global agenda?
Thanks very much, and good day, everyone. A very interesting question you have brought forward. And basically, I think the very first thing that stood out to me was connecting. Because today I stand on the backs of numerous goodwill people such as Dr. Natalie Graves, Raquel Santiago, Enrique, and so on, and Mike Campbell, who would have all contributed to this agenda, but who prior to this agenda, we weren't connected. In the meeting in Barbados, it's interesting, it's the first time I actually met some of my colleagues who work with me at the University of the West Indies and who worked on this agenda. So that's the first thing. It was truly connected for the region. But beyond that, on a very tangible level, what you found with this agenda in Latin America and the Caribbean was two main things. One, the more different we are actually similar. So language, all of these barriers, are very, very, are not really different because the issues are the same that we face. Once we're able to break down that barrier at the end of the day of language, for example. And we had significant help from our people in Haiti. And the second is the Caribbean is a region, just as Latin America, that is always prone to hurricanes. And as you all would have seen recently, Beryl, and I sympathize with our leader, actually, Ambassador Bristol, where Carriacou, one of the islands, has been totally wiped out. Two important points that came through. One, that let me know why I am as a pharmacist involved in this, because the research agenda question that reflects on assessing the impact of heat on the bioavailability of medication used to treat mental health conditions within Latin America and the suitability of medicine storage. We always speak about this because most clinical trials take place in the global north. They are not contextualized to the heat and other conditions that we face in the global south, and especially post-disasters. And the other issue that we face is that which, it was a very dark issue, but it's one that really needs to be confronted and dealt with, I think, very urgently, which is measuring the prevalence of gender-based violence occurring in the climate change and marginalized, in the climate change vulnerable and marginalized women and children post-disasters. And that has been something that really resonated with me. When we speak about vulnerable, we usually think about the house blowing down, persons falling through the crack, and so on. But we don't think post-disaster, the violence that also takes place, the vulnerability of persons to violence, and those that are vulnerable are even more vulnerable to those acts. And that, to me, were two of the key issues. There are many more, but I know I don't have an hour, but to just share this morning that really stood out and resonated with me in Latin America and the Caribbean. Thank you, Omni.
Thank you so much, Sandeep. And we wish we had an hour with you to hear more about the agenda and as you said, how the Latin America and the Caribbean came together in connecting climate minds, heard from the people, defined what vulnerability means in the context of climate change. But thank you for highlighting the issues of vulnerability, especially for gender-based violence in post-climate disasters, which is often overlooked by many global leaders. And now that takes me to Ayo, and to ask you, as we know that young people, particularly children, adolescents, and youth, are also one of those vulnerable groups, and would love to know, and would love all the webinar attendees to know your experience of developing the Youth Research and Action Agenda on Climate Change and Mental Health, which was independently and completely led by you and young people in the project.
Yeah, thank you very much, Omnia, for that question. First, I would like to honor the lived experience working group members, youth advisors, and other lived experience collaborators, the wider CCM team, and even participants who contributed their expertise to create the Youth Research and Action Agenda and other youth outputs. CCM project is significant because it sought to develop a global research and action agenda and actively worked to infuse and give voices to lived experience perspectives in the research process. And this led to us at SustyVibes having the opportunity to lead the youth work as part of the lived experience working group. To take the lived experience role, we had to create foundational frameworks to guide and support our lived experience engagement within the regional communities and other additional project activities. This meant that the core team partook in decolonizing and trauma-informed webinars to highlight and unlearn harmful research practices. The lived experience working group also co-created documents to inform our lived experience approach, like the meaningful youth engagement, lived experience terms of reference, and storytelling guidance that guided our approach to ethics, inclusivity, and story gathering. Having this foundation guided our approach to youth work. At SustyVibes, our work is youth-led and focused, youth-led and youth-focused, basically, and we often use pop culture to drive our advocacy. Although CCM differs from our usual processes, we wanted to maintain our inclusion of pop culture and fun in the research process. Our priority was to ensure that the research was not tedious for young people, who have always seen research as boring and disconnected from reality. Secondly, we also wanted to ensure that our findings and recommendations truly captured what young people wanted to see with regards to climate change and mental health. These priorities inspired the design and development of the agenda and also the dialogue methodology. The agenda, was designed to inspire youth participation in climate change and mental health research through an open, empowering, creative space free of adultism and tokenism. We were intentional about co-creating the spaces with youth leadership at the forefront, not only when it came to myself and my colleagues, but also with the Youth Advisory Board and other participants. Our dialogue embodied diverse experiences. For example, our virtual dialogue, we had participants from the 7 UN regions representing 27 countries. Recognizing the limitations of virtual gatherings, we also took the discussion offline and engaged young people in local communities who were not digitally connected to the conversation. And we did this by hosting 2 regional pop-up dialogues in Port Harcourt, Nigeria, and in Bangalore, India. The project planning process was demanding, but it was ultimately rewarding as it enriched our agenda with a multitude of insights. We produced a robust research and action agenda that not only identified climate and mental health research priorities, but also proposes actionable solutions tailored to young people. On a personal level, this experience has been educative and impactful. It allowed me to deepen my understanding of lived experience research and increase my capacity as a researcher, a collaborator, and an advocate. I also learned from, co-created, and connected with a global and diverse network of experts. The journey developing this agenda was challenging, but it was also fulfilling. and it stands as a testament to what young people can achieve when given the platform and the support. Thank you.
Thank you so much, Ayo. And it is such an honor to have you and to have the youth way of doing dialogues. You not only led the youth dialogues in a meaningful way that is based on values and principles co-created with young people, but you redefined how research can be led by young people through the youth agenda and the global agenda. So thank you again. Now I'm going to turn to Alan, and you know what my question is going to be in terms of what's next and what you would want to see happen with the global research and action agenda in the next 5 years, and how can we bring funders in the implementation of the agenda?
Fantastic. And please, could I start by saying how absolutely delighted I am to be here with you today at the end of what has been a 1.5-year journey that has delivered such an exciting research and action agenda. So a huge congratulations and thanks to Emma and Jessica and Omnia and all of the Connecting Climate Minds team. I mean, we at Wellcome are really, really thrilled to be at this stage. So climate change, of course, represents the biggest threat to physical and mental health globally. And we at Wellcome have a mission to put health at the heart of climate change action. And we're supporting a transformation in the scale of the research on the link between climate change and health and the necessary solutions, but also a transformation in the nature of the ecosystem in which that evidence is being demanded and is being used. When we started our support for this wonderful project on the availability on research and everything on the links between climate change and mental health, it had various features. Number one, it was very limited in the amount of research there was. Number two, it was very partial in the scope of the work. Number three, was geographically horrifically imbalanced. So much of the research was in the global north and very little in low and middle income countries. And fourthly, of course, it was largely disconnected. It was a silo of research conducted over there and not connected across fields and with the policy community. So to achieve a world where no one is held back by mental health problems, it's essential that we have a better understanding of how climate change is affecting mental health. And I think this report really, for the first time, delivers some essential clarity that significantly advances the field. First of all, it sets out the amount of research that is available, and that research is growing. We're funding some, but there's lots of new research being conducted. Secondly, it identifies what we know and what we don't know, what is yet to be discovered and what is yet to be better understood in different parts of the world. Thirdly, and I think this is, the first Sandeep mentioned this as well, that word connected. This work has gone to extraordinary lengths, and also Ayomide's comments, to connect a global research community. So not just the researchers, but the communities in which this research is important. And finally, I think this report what it's really done is laid out clearly how future research must be conducted. And I think there's some essential learnings for us all there. And I think the key hope I have for this agenda is that it'll drive, we funded it because we need to know what do we still need to do and how can we do that. So what I'm hoping is it'll drive the essential and the urgent action that is needed at the intersection of climate change and mental health. And that means more, and that means better research in understanding the biological, psychological, social, and environmental interactions between climate change and health. Bringing researchers from different backgrounds and communities and people with lived experience together in those countries that are most affected to design the research and to deliver the research findings. But we must also move from a research and an academic, as I see a very powerful comment in the chat, we must move from a research agenda to an action agenda. So what are we really going to do with that research, and linking researchers with policymakers, with those people in charge who can make sure that mental health features in the climate-related policies and commitments around the world, so that we can move those findings and turn them into action. So as a financially and politically independent philanthropy, we at Wellcome have a critical role to play here. And philanthropic organizations are uniquely positioned to convene stakeholders, community groups, researchers, policymakers to help affect change. And tackling climate change and health requires experts from many different disciplines to work together and breaking down those disciplinary silos. As a leader in this space, we at Wellcome are committed to supporting that sort of transdisciplinary research that leads to the solutions and the policy actions in this critical intersection. And we look forward to continuing to work on this intersection between climate change and mental health in the coming years. So thank you very much indeed for inviting me along.
Thank you so much, Alan. And truly, Wellcome has set an example of how to meaningfully bring in a global research community to help us do the connection across all the different fields. And we are grateful for that opportunity and to many more years of working together on this agenda and on the global climate and mental health community building and research. So thank you again. And now our last expert and also the chair of our advisory board, Pamela, we would love to hear from you. Why is it important, as we talked about transdisciplinary, bringing many different experts from the field, why is it important for experts from the global mental health space to engage in climate change and then the upcoming climate and mental health nexus field?
Thank you, Omnia, for that question. And I also just want to say that it's a pleasure to be here. And I want to thank the CCM team for leading this amazing work and for inviting me to join. So I actually feel like I'm a great example of the target audience for this report because I'm not a climate health researcher, but I have been involved in global mental health for the last 30 years. And when I received this invitation, although I thought, climate change is not my area of work, I recognize how important it is. This is a critical global public health issue, and I really wanted to learn. I wanted to be able to take a deep dive into getting a sense and understanding better how climate change and mental health do interact. So global mental health as a field responds to environmental, social, psychological, and biological determinants that influence risk of and protection from poor mental health. And our goal is to develop interventions, whether these are policy, social, behavioral, or otherwise, that prevent people from experiencing mental health conditions and care for them when mental health problems are present. So climate change is a critical environmental determinant of mental health that interacts with all of these other determinants. And as a public health threat, it's an important area of research for global mental health investigators. I do want to note that traditionally, global mental health practitioners and researchers have responded to humanitarian emergencies, including severe climate events. And the field of global mental health contributes a very rich evidence base for psychological interventions that have been developed, adapted, and implemented in diverse cultural contexts that reduce symptoms that are associated with trauma, anxiety, and depression, much of which we see after climate disasters. And we have a toolkit of interventions that are acceptable and increasingly accessible due to creative modes of delivery. So this is a field that has a lot to offer the climate research field. And these interventions, as well as the associated cross-cultural research knowledge, are resources that should be applied and brought into what we do in climate change and mental health together as we explore the mental health effects of climate change around the world. I also feel like this field and certainly this research agenda shows us that we can get to some very important questions that require thinking from across disciplines. And those include understanding the factors that enable individuals and communities to maintain strength in the face of uncertainty and risk. What are the psychological and behavioral strengths that better equip us to manage emotionally and respond to uncertainty? But also, how do the policy interventions that reduce social vulnerability support mental health in the context of climate change? So these are ideal transdisciplinary questions, and I think that the report makes clear the value of this kind of interdisciplinary research. So thank you.
Thank you so much, Pamela. And we completely agree in terms of so much that the global mental health space can bring into the climate crisis, but also the climate opportunities we have for improving and strengthening good mental health and well-being. So thank you for that. And now I'm going to invite all the panelists. I'm going to ask you one question. We are taking notes, so we are going to hold you for this commitment. But what is one action in 30 seconds you would take to implement or to help implement the global agenda? So Sandeep, I'll start with you.
I think the first action is what we are doing here today, which is bring awareness to the agenda but more importantly, beyond awareness, ensuring that we are able to break it down to make it contextually relevant and make it resonate into the societies where they were developed. That's the only way we'll get power behind the agenda and understanding behind this agenda. Thanks.
Thank you. So we need awareness and we need to build understanding and integration. Ayo, over to you.
Yeah, thank you, Onya. So one thing I have been doing personally is working at the intersection of research and civil society to incorporate the relevant evidence from this research to guide our advocacy and on-ground project at SustyVibes. And we're already putting this into action through a youth declaration document based on the findings and recommendation from the youth dialogues from the project. And we planned a launch session in early August to spread the word and to get more young people to support climate and mental health recommendations.
Thank you, Ayo. So working more, not only with policymakers, but we also need to work with civil society and a commitment for all of us to attend the Youth Declaration launch happening in less than a few weeks. Alan, over to you.
Thanks very much. So I was an academic for 20 years, which I loved. I moved into this role a couple of years ago, and it's a slightly bonkers role in that it enables you to do all sorts of amazing things. It's incredibly privileged. I'm incredibly privileged to work here. So what we can commit to is spending a huge amount of more research funding for research in this area. That's a commitment we're making, you'll see later this year. We are also committed to working very closely with our peer philanthropies to ensure that they too recognize the impact of climate change on mental health and focus their research funding opportunities on the intersection as well. And finally, we edit documents which go at very senior level. We have opportunity to feed into those documents, and we put in physical and mental health into every one of those documents where possible. So we have very fortunate to have multiple ways of influencing this agenda, and we're very excited to be doing that. Thank you.
Thank you, Alan. And we are very fortunate to have you support us through funding, but also through influencing policymakers at the highest political level. Thank you again. And Pamela, your last call to action.
Thank you. I feel like my role in this is to assist with dissemination. I sit at the nexus of two areas in mental health. One is public health and mental health. So how do we influence population mental health? I think there are huge opportunities for thinking about climate change and public mental health, right? And the second one is psychiatry. I'm in the American Psychiatric Association. I have a leadership role as chair of the Council for International Health and Psychiatry. And there we have a group of psychiatrists that are actively involved in advocacy for climate change and mental health research and action. And so I think that's another group that's really ready to get involved and join a global community that's working toward these goals. So I'm looking forward to doing that.
Amazing. So we always say that this Connecting Climate Minds is only the beginning of bringing more people, more communities and groups together. So we rely on each one of you to do that and to increase the community. So now Emma has also joined us. And before we let you go, we have a short Q&A session. And many of the participants have already shared their questions. So I'd like to ask a question, and please, any of you would like to take it through. The first question we received is, why has mental health lagged behind on climate change and health policy development and implementation in your perspective? I know, Alan, you touched on that a little bit. So if you'd like to take that question, and anyone can please jump in.
Yeah, well, I mean, I think it's there's so much still to be learned on the intersection between climate change and health broadly, both physical and mental health. And I think we're dealing with the most obvious impacts first. So heat is the most obvious impact of climate change on human health. And we welcome funding large amounts of research in that area. But as our understanding of the broader impacts are clearer, and as, in fact, frankly, we talk to communities more and affected communities more, we are recognizing that there are many more broad impacts that we need to understand. And it requires a certain type of academic and a certain type of academia that will enable research across disciplines and research across silos. And that's a challenge. but one that we're up for. But it's a challenge for academia that will permit the sorts of research that is needed across these very different parts of science. Thank you.
Thank you, and completely agreed with the need on how to foster more transdisciplinary research and how climate change and mental health lie specifically at that nexus, which is a challenge in itself. Anyone would like to add before I ask the next question? Okay, in the interest of time, our second and last question is, are there communities in the issues are there any commonalities or similarities that you have seen in the issues during the dialogue, particularly in the Global South, or are the issues related to climate and mental health more country specific? And I know, Sandeep, you touched on that, so would you like to take that question?
Well, yeah, so there are some, obviously, that will be specific to different areas, such as migration, would have been an issue that would have been contextualized more to Latin South America. But then you find issues such as hurricanes. I mean, or typhoons happens in only certain parts of the world. So those types of risk are obviously, risk factors are somewhat different, but there are many commonalities. And what I find to be one of the main commonality that was impressive to me was the resilience shown by vulnerable groups. If you read beyond the agenda and the case studies that have been put out there by many of these groups, there are very, very positive actions that are taking place across the world in small areas that you don't expect persons to take those actions to make change in both climate change, mental health, but solving their problems. And that resilience and that commonality across all agendas, all case studies that have been put forward, to me was a real revelation out of this project. So I hope I've answered your question, but those from my perspective are what would have stood out.
Yeah, thank you, Sandeep. And I would also invite the participants to check our Global Online Hub. We have many of these incredible case studies, which are the interventions led by local communities and young leaders that we wanted to elevate and platform. But we also have lived experience stories of people's own stories of distress, but also stories of agency and bringing their communities together. So we'll post the link to the hub on the chat now. There's another question that came through, and I would also love to maybe ask Ayo or Emma to take that question, or Pamela as well. If you know any research that was done on climate anxiety or the impacts of climate change on people who are living with mental health conditions or people living with disabilities, which I know has been brought up in many of our discussions, particularly the ones that we had during the COP28 in the UAE.
Ayo, did you want to go first, or I can come in?
I think Pamela wanted to come in.
Oh, sorry, Pamela.
No, I was actually going to see if you were going to take that, Emma. But no, I don't know any of those specific studies, but I just also wanted to underscore the importance of addressing these issues of disability in the context of climate and mental health, and because I think that's an incredibly understudied area.
Yeah, so I think people are starting to do research in this space, and I can see in the chat as well, or in the questions, it's also been brought up around neurodiversity, so experiences of like ADHD, for instance. That's another area where people are starting to explore how people with different ways of seeing the world, different ways of experiencing the world, and different levels of and types of disability, what are their lived experiences in the context of the climate crisis. And we've heard many lived experience stories of how that strongly links to mental health, because, for instance, if you're in a wheelchair and there's a flood, you know that you're not going to be able to escape that flood in the same way as an able-bodied person. And so that is bringing a lot of extra stress and trauma in the anticipation of those kind of events, for instance. And another challenge to mental health of people with different disabilities that we've heard is also not feeling represented, and that they are being listened to in these spaces, or that their needs are being centered in the decision-making spaces. And so that can also be a stressor that can affect mental health and well-being. So just to the question that came out in the chat around how people express that as well, we definitely saw people speaking of things like headaches, sleeplessness, and other sort of stresses, and they might not express it as a mental health challenge like anxiety or depression in the same ways as we might in a country like the UK or Australia, where I'm from. But that was what we saw was really, really important, was also to understand how these different understandings and expressions of mental health and well-being, including like from Indigenous communities, who one of our wonderful Maori contributors said, you know, when I am well, when the lands are well. And so there is a deep intersection and interlinkage that can't be divided between emotional health and mental health and the health of the environment. So we definitely had a huge diversity, and there is a real need to uplift those different experiences and reflect them in the evidence that then informs the kind of policies and decisions that would, you know, protect people with disabilities, for instance, in the context of the climate crisis, and ultimately support better mental health outcomes for them as well.
Yeah, thank you so much, Emma. And I would also encourage the participants in the agenda. You will also find how the experience of us understanding what mental health means for different communities, and what are the ways that our participants, our experts, but also the different regions understood what we meant by mental health and how that evolved, but also how they describe their feelings towards climate change and the impacts of climate change on their mental health and their well-being. Ayo, would you like to come in with any of the insights from the youth dialogues around that issue?
Can you hear me?
Yes, we can.
Okay. I didn't get your last statement. What was that?
We're talking about climate anxiety, and if has any research been done, but also how young people in the dialogues have seen that or expressed their feelings to it.
Yeah, I totally agree, you know, with what you said, that the language was different, you know, people express it differently. For example, when we're in Port Harcourt, they were not really talking about mental health, they were more talking about they were talking about stressors from like social issues and environmental issues, and how that affected their emotions, but not really bringing it down to mental health. But, you know, through the discussion and, you know, after the feedback from the agenda, you know, they got that connection. So the language might be different, but it is really it's the same, so to speak, in a way. Like when you understand that connection, then they realize, okay, this is what we're feeling, and we can connect to other people, you know, using this kind of language.
Thank you. Thank you so much. Now I'm going to pass it on to Emma for closing remarks, and a big thank you to all the panelists for your time, for your support, for your partnership, and to many more projects and collaborations together. Thank you again, and over to you, Emma.
Thank you so much, and thanks so much to the panelists. I can already see in the chat that some people are starting to connect and send each other back and forth questions or answers or emails. That's wonderful to see, and is the kind of connections we want to foster. We've been so fortunate to build this global community of practice that we would love to have people join, and we would love to continue to foster so that we can implement this agenda in the right ways together and inclusively. So to do that, we would love if you can join our Global Online Hub Collaborate area, which is just being popped in the chat now, so you can connect to others and also check out the resources on the site. And please get in touch with us, and you can then also join the regional communities of practice in your region, which we are hoping to mobilize funding to continue to support. It's been an honor to, as always, to hear from the wonderful panelists, and that just gives you a taster of all of the voices that we've heard over the last 18 months. And I'm sure you can see how rich the discussions were. So we've done our best to capture that in the agenda. I'm sure we can't capture everything though. So please, again, check out the regional agendas and also the agendas by and for young people, Indigenous communities, and small farmers and fisher peoples. This agenda will only make a difference to the people living with the mental health consequences of the climate crisis if it's taken up, invested in, implemented. So again, I just love to encourage you all to please spread the word and to join this growing community. I'm going to now hand over to Professor Sir David Nabarro, who's one of the leads in the Climate Care Centre and also the Institute of Global Health Innovation here at Imperial College London, who's been a huge supporter and contributor to Connecting Climate Minds, to give some closing remarks, but just to bring out some of the key themes we've heard resonate today.
Thank you very much indeed, Dr. Emma Lawrance, and greetings to everybody. I'm connecting with you from Rio de Janeiro in Brazil, where I am at the moment. I've got 6 comments that I'd like to make. First of all, this is urgent. Don't let any of us walk away from here thinking it's something that can be put off for a year or 2 while we sort ourselves out. It's happening now. And secondly, Connecting Climate Minds has been really a very valuable piece of action research, surfacing diverse expertise, including lived experience, absolutely multidisciplinary and focused on informing priorities. The immensity of the process, involving 960 people across 90 countries, is almost impossible to conceptualize, yet it's been done, it's got a result, and it's truly been and continues to be a connecting experience across regions, disciplines, and people. But it's not just a great thing, it's also been done with a particular style, because how research is conducted is vital. And we got to make sure that the evidence informs decision-making, but we need meaningful partnerships with people who are experiencing this, what we're looking at, and they've got to be able to be part of it. And I think CCM has shown how research can be led in inclusive ways, as we heard from Ayo, who shared some of the youth-led work. And then the content of the research is important, the substance. It's got to be interdisciplinary, and that's often challenging because we don't tend to instinctively work in interdisciplinary ways, but the toolkits of interventions that have been offered, I think, are really, really important. And so to my own emotions. Emma and colleagues, I am proud to have been involved in CCM to a degree that I find impossible to explain to others, because it's been a remarkable endeavour by everybody who's taken part in it, by those to whom they're connected. And it's been super courageous by those who funded it, some of whom are present with us today. And that's why we must build on it. Every one of us must join together in investing in and implementing this agenda, and in the important role that diverse forms of expertise have to play in catalysing climate change and mental health research. And that means we must be political. We've got to be ready to connect with those who have the power to make decisions, helping to raise awareness, break it down to more contextually relevant and resonant activities, as you've suggested, but working with diverse partners, including civil society, to build meaningful bridges across disciplines, across sectors, among stakeholders, so that we influence at the highest levels of policy and practice. Thank you for coming. Thank you, everybody, the team in particular, for all you've done. Thanks to the 960 people who did it all. And thank you for giving me the chance to come and share this with you. My heart goes out to you, Emma and team. Wonderful.
Thank you so much, David. And thank you to you all for joining. Just to finish, I want to acknowledge that unfortunately, one of our colleagues, our dear colleague from the Red Cross Red Crescent Climate Centre, who started this project with us and was actually in the interview with us for the project to secure the funding, Dr. Pablo Suarez, sadly passed away very unexpectedly recently. And I know some of you on this call will also know him and have been touched by his life and work. But he was an immense presence and contributor to the power of play and joy, of connection, of creativity, of humor, and really inspired the way of working through this project. And at the launch, he said that as humanitarians, we are witnessing a terrifying pattern. Changing climate risks are impairing the mental health of those we serve and of our own teams. If the interplay between climate change and mental health is not fully understood and addressed, psychosocial concerns can paralyze and demotivate the very same people who need to turn early warnings into early action. This new and exciting work funded by Wellcome will improve our collective ability to anticipate, diagnose, and provide proper support, harnessing the power of darkness to pursue illumination and transformative action. And Pablo's genius was in showing that playfulness, joy, and humor are not only important means to an end in bringing us together as hearts and minds and sustaining challenging humanitarian work, but a vital end in itself for living meaningfully, including in the climate crisis and including with lived experiences of mental health challenges. So the Research and Action Agenda hopes to inspire the continuation of Pablo's vision and the vision of those who contributed to it around the world, who all hoped for a world where joyful connection can bring us together to connect what we know with what can be done and create a safer climate for our minds. So thank you all for joining. And yeah, it's my privilege to hopefully work with you going forward on making this a reality. Thank you, everyone.